Hi, I am Dr. Nik NIkam. Welcome to All India Radio Houston presentation. I'm going to talk about heart attack, what causes heart attack, and how we recognize it. So let's proceed. Let me bring this into the presentation window. Let me share this picture. Okay, here is a picture of the heart. Heart is supplied by two main arteries known as the left main coronary artery and the right coronary artery. And here is the left main coronary artery, which divides into the left anterior branch, which supplies the left ventricle, and the wall or the septum that separates the two ventricles. Similarly, it wraps around the left side and supplies the lateral wall of the ventricle. Whenever there is a buildup of plaque in a coronary artery, there is a reduced circulation. Here you can see the buildup of a plaque, which consists of cholesterol, platelets, calcium, and smooth muscle cells. As the plaque builds up like a mountain, the lumen of the coronary artery is progressively reduced. When the narrowing encroaches 90% of the lumen, the blood flow through this narrowed lumen becomes sluggish. Whenever there is a reduced blood flow, there is a tendency for these platelets to aggregate and form a clot. And when there is a complete occlusion of an artery, there is no blood circulation through that branch of the artery. Just as when there is no supply of water to a section of your yard, it dries up. In a similar manner, when there is total occlusion of the coronary artery, that area of the heart muscle which was supplied by this artery gets no blood circulation. That leads to a heart attack or death of the heart muscle. So when the heart muscle is dying, that produces a severe chest pain, which is associated with sweating, weakness, palpitation, sometimes dizziness. Occasionally, this acute occlusion of a coronary artery can produce fatal arrhythmias known as ventricular fibrillation. 50% of the people who have an acute heart attack may die before they get the medical help because of ventricular fibrillation. Hence, it is very important to recognize chest pain and reach an emergency room as quickly as possible. And over a course of several weeks, this dead heart muscle is replaced by a scar tissue. Of course, the scar tissue is thin, it is weak, and it doesn't contract. So it doesn't contribute to the heart to function. So occasionally, this weak scar can bulge and form an aneurysm. This is a brief description of how a heart attack develops. In the next video, I'm going to talk to you about what doctors do in the hospital to minimize the damage to the heart muscle. Thank you very much.